with you. Now I don't need your wings to fly. No, I don't need a hand to hold in mine this time. You held me down, but I broke free. I found the love inside of me. Now I don't need a hero to survive, 'cause I already saved my life.
Hi, Susan. My name is Rosini Sloan. I'll be your occupational therapist. You can have a seat right here. Alright, so I hear you're here for occupational therapy because you have right side paralysis only in your right arm. So tell me about your life before you've experienced this symptom.
A lot of things happened. I got kicked out of school, and I paid $75,000 for that.
Ooh.
Yeah, and then I found out my boyfriend cheated on me with my best friend, and I felt so depressed, and I also feel stressed out because I have to pay back $75,000. Yeah, and then after like a couple weeks later, and then I just realized that I get tired easily, and then I cannot move my right arm anymore. Yeah.
Okay. Well, do you know a lot about conversion disorder?
Not really.
No? Okay, well, let me give you a little background about conversion disorder. So, just a little background. So, 2 to 5 people out of 100,000 individuals get it in the United States. It happens actually from intense stressors. So, in your case, I'm guessing it's breaking up with your boyfriend that you've had for a few years. It's getting kicked out of school. It's because you have financial debt. So those are all the things that can contribute to that. Okay, and that's how you get these symptoms. There's a good prognosis to it. People usually don't have the symptoms after a few days to a few months. So the earlier you get treated, the faster your recovery will be. Right? So for occupational therapy, we're trying to get you to engage in things that you love because that will contribute to your recovery. So what are some things that you like to do?
I like to go out with my friends. I like to go shopping. I like to dress up myself.
Okay.
Those things make me happy, but I don't do those anymore because I really don't know how to use only my left arm to do all those activities.
Okay. Well, we definitely want to have you participate in things that make you happy. Like I said, that will contribute to your successful recovery. So let's start with shopping. I think I have the clinic set up for you. Do you want to try to do that first?
Yeah.
Sure, let's go. All right, Susan, so I set up the clinic for you just like a shopping mall. So tell me, how do you typically shop?
I typically just carry a lot of stuff with one of my arms, and I would just continue shopping with my another arm just to pick up the stuff.
So if I'm hearing you correctly, so you usually just put stuff just like this and like that? Okay. So to help you adapt to that, modify that, you could actually carry a tote bag, which is really light, so you can carry it with you everywhere. What you have to do is just put it around your neck, and you can just grab your clothes just like this and stuff it in your bag. Okay, you want to try that?
Yeah.
See if that works for you.
Like this?
Yep. Good. How does that feel?
It feels nice.
Good? Okay, awesome. Alrighty, and I can grab that. Thank you.
And I feel fatigued easily.
Oh, well, for that, a lot of stores actually have little platforms or chairs that you could just sit on. You usually see a lot of men waiting for their wives, so you could sit on that if you really want to for a couple minutes. Or dressing rooms, they have little benches that you could sit on. If you're trying on clothes, you could just rest for a good minute or two, okay? How often do you usually go shopping?
I usually go shopping like every weekends,
Okay.
but I feel tired easily, so that's why I don't go out that often. And I usually shop like 6 to 8 hours because I
6
really
to 8
like.
hours.
Yeah.
Okay. All right. Well, since you easily fatigue, maybe you want to separate that day instead of going on Friday for 6 to 8 hours like you usually do. You could maybe go like on a Monday and then a Thursday for an hour or two. I wouldn't suggest going on the weekend because everyone gets rowdy. People want the best sales on the cutest shirt or whatnot, and that could actually add to your anxiety and your stress levels, which we don't want to do. Okay, just lay this on the bench, which is in the dressing room. If it's shorter, which it usually is, you could just bend at your legs and not bend at your back because you don't want any more injuries. So you just take your right arm to stabilize it, just take off the hanger, just like that. Okay. Can I see you try that? Was that easy enough for you?
Yeah, it's easier.
Good. Okay. So to show you dressing, that actually was my other intervention that I was going to show you. We're actually going to go to another room, okay?
Mhm.
Great. So let's go and let's practice dressing. So we're going to practice putting on a shirt first. Okay, so what you're gonna do, and I'm gonna do it with you, is you are going to actually put the right sleeve in between your legs, just like that. So the hole, you can see the floor through the hole. Okay?
Mhm.
You're gonna open it up, and you're gonna pick up your right hand. Oh, there we go.
Mhm.
Pick up your right hand, and then throw it through the hole, and then lean forward while it goes through the hole, and you're gonna lift the shirt up past your elbows. Just like that. Perfect. You could lean back. You're gonna put your other arm through the other armhole, just like normal, and then put it above your head. Just like that. You could use your left hand to pull it down. Perfect. Now to take it off, what you're gonna have to do is put it more on top, just like that. And you're gonna reach to the back and then push it above your head, or pull it above your head. Keep on going, you got it. Perfect. How was that?
It's better.
Good? Okay. All right. Now, we're gonna practice putting on your pants. So, here's some pants for you. Okay. So I know that both your legs are working, so this is called the figure four technique. So you're gonna put your legs crossed just like this in a figure four, and you're gonna use this hand and put this leg through the right leg. And you can lift your legs so it's through and make sure it goes past your heels, and then pull it up right over here. Past your knees, and then you can put your foot down, and then you could easily put your other leg through the other side. Then you can stand up and put it on just like that. How does that feel?
It feels better.
Good? Okay, awesome. All right, Susan, you did a good job shopping and dressing. So I just wanted to talk to you shortly about some stress management skills. So what you could do for journaling, I know you can't write, but with Siri, you could actually talk to her on the phone and tell her whatever you want to write, and she'll type it for you. You don't want to keep in any stress or any anger because that could trigger another conversion disorder. Or you could do support groups. I could show you. I'll send you home with a list of the 10 best ones that are local to you. You could go to the group, or you could actually just talk to them online if you need to talk to someone right away. And then next week we could talk about any other things, more stress management skills that we could work on, okay?
Yeah.
Okay. Is there any questions you have for me?
No, I'm good.
Okay.
Thank you.
Awesome. I'll see you next week then.